Hello, this is Sarah Hinkle, and this is my NSC 892 poster presentation for my evidence-based project regarding skin-to-skin contact effects on exclusive breastfeeding rates. Now, the problem from my project was low exclusive breastfeeding rates and the need for healthcare professionals to use evidence-based practice, patient education, and implementation of skin-to-skin contact to improve exclusive breastfeeding rates. Now, some background on my topic. Healthy People 2020 advocate exclusive breastfeeding for 6 months, stating that breastfeeding is the optimal way of feeding infants. Now, from my research, Branson, Lee, Moore, and Lopez stated that mothers who experience early skin-to-skin contact are more likely to have breastfeeding success during the postpartum period versus no skin-to-skin contact. And then on my poster, I displayed a graph that shows evidence from the World Health Organization showing their Healthy People 2020 target and then the baseline. The purpose of my project was to educate staff regarding the importance of encouraging immediate skin-to-skin contact to increase exclusive breastfeeding rates. The target audience was registered nurses and obstetrical technicians from Baptist Health Corbin's obstetrical unit. By educating staff first, healthcare professionals will educate patients adequately with the best evidence-based practice, and this will ultimately improve women and children's health and increase exclusive breastfeeding rates in the nation. Synthesis of my literature review: I reviewed 8 studies and 1 literature review, and then evidence from the World Health Organization and the CDC. All the evidence concluded the importance of skin-to-skin contact on exclusive breastfeeding rates and the need for patient support and education. I implemented my project at Baptist Health Corbin in their labor and delivery and obstetrical unit. There was 10 participants, 8 nurses, and 2 obstetrical technicians. I developed and displayed a cover letter that discussed the participants' protection and their obligations in the project. The PowerPoint presentation lasted 10 minutes and the discussion lasted 5 minutes. And I discussed with the participants the reason for the discussion at the end, which would evaluate the strengths and weaknesses of my project for future progress on my topic. I simply asked the participants if they had any questions, comments on my presentation or the topic. And then to evaluate my presentation, like I said, 10 people participated in my project. They were attentive, they nodded their head, they verbally agreed and made comments. So I feel like the likelihood of the staff acceptance of my intervention is high. Upon discussion, they verbally agreed that skin-to-skin contact was important, that it was both beneficial to mom and baby, and the success of exclusive breastfeeding. And then some even told stories of how skin-to-skin contact personally helped with their breastfeeding. So that was some strengths, but some changes that need to be made. Even though a lot of them agreed on the importance of skin-to-skin contact, they kind of shed light into some limitations of implementing skin-to-skin contact that need to be addressed, such as if they have a busy workload, there's a lot going on, maybe more patients delivering in the unit, or there's an emergency that they feel like they need to transfer mom's care to women's health and transfer baby's care to the nursery, or simply they're tired, they've labored mom all day and all night or whatever, and they're ready to transfer care, which is understandable but also disappointing, because we need to think about the benefits of the patient first. Also, some changes that could be made is to do the presentation at a different time. I implemented in the evening, which was late for day shift and early for night shift. So I could do it at a monthly staff meeting, and I would get more participation and more comments for future progress on the topic. So, overall the project I feel like was a success, and people agreed to the intervention. However, in order to successfully improve the facility breastfeeding, improve exclusive breastfeeding rates in the facility, I need to address the limitation issues for future progress on this topic and presentation. But overall, I've enjoyed learning about but once again, this is Sarah Hinkle, and this is my poster presentation for NSC 892.